Thank you so much for joining us. Happy beginning of the school year. Uh, we are excited to get the school health updates back and running for the school year. So our agenda today is that we have just a couple of announcements, and then we're going to hear from our epidemiology department in regards to RSV, flu, COVID, as well as some heat updates. And then we're going to hear from our health navigator over at the Youth and Schools community, Kayla Allender, around health navigation. And then we will be hearing from the T-Mobile unit that is supposed to be updated to from Ann Hoffman, who is over at our clinics. And then at the end, of course, if you have any questions, either during the presentations or at the end of the presentations, we encourage you to put it into the chat. With that being said, one announcement, of course, we're going to be starting up our monthly newsletter for announcements, resources, and more. If you want to sign up, you can click on the screen. This is an interactive PowerPoint, so you're able to click links on the screen in real time to sign up for that. Another announcement that we did not put on here as well is that if you know any other school health staff, that includes nurses, health aides, anything of the sorts, who you believe is interested in joining these calls, we encourage you to reach out to our school support line and we can get those people added, or you can go ahead and forward those invites that you received as well. We want to ensure that everyone, all of our wonderful Pima County school health staff are able to join these calls. So with that being said, I'm going to turn it over to our epidemiology. Eliana, are you on the call?
Hi, everyone. Good afternoon. I know the screen says that it should be Jake and Jamie giving us updates today, but my name is Eliana, and I've been on this call before, and it'll be me. I'm also an epidemiologist here in our health department. Next slide, please. For today, we have prepared a quick respiratory update and also a heat youth update for those in the call. Next, please. Respiratory season, when we talk about respiratory illness, we've presented here before, but just to have it clear, we usually discuss RSV, flu, and COVID-19. For an RSV seasonal report, we are about 3/4 into our season, and we have seen 0, if not 1 or 2 cases, respectively, for each week for the last 2 months or so. People most affected continue to be those 15 to 64 years old, with the second group most affected being children 1 to 4 years old. But the week that this report is has information for was actually the week of July 20th. And that week there were 0 cases, which is 100% decreased as compared to the week prior. Next slide. For our COVID-19 yearly report, this is the one morbidity, the one disease out of those 3 that I'm covering today that we've seen an increase, a summer uptick, as you might want to call it. The people that continue to be most affected by COVID-19 in Pima County are those 19 to 44 years old. And for this last week of July that I'm covering, we saw a 4% uptick as compared to the week prior. And for the last month and a half or so, we've definitely seen an increasing trend of COVID-19 in Pima County. Next slide, please. Influenza is similar to RSV in the sense that we're seeing decreased trends. We are same as RSV, about 3/4 into our season for the 2023-2024 season. And we also see that the people most affected are those 19 to 49 years old. It says last week, but that last week of July, there were only 6 flu cases in Pima County, which was almost 50% decrease from the week prior. And we've seen this decreasing trend in flu cases for the last month, if not month and a half. Next slide, please. For respiratory disease, I always like this slide. It just kind of puts everything in context. Biggest takeaway decrease in flu and RSV. And unfortunately, we have seen an uptick of COVID-19 cases, but nowhere near what we have seen in prior years, thanks to vaccination and therapeutics. Next slide, please. Just a quick reminder to all our school partners, school administrators, and also for childcare establishments, there is communicable disease reporting that is mandated by our Arizona Administrative Code. And this slide just quickly covers what continues to be mandatory reporting communicable disease in schools. The link is within the slide. Who needs to report? It needs to be a school administrator or somebody that works in that health office or assigned staff. I know that varies based on the school. What is reportable? You can see this list here. Some very specific diseases, but also some clusters. So an increase in diarrhea, nausea, vomiting, for example, or an increase in scabies. A few students that are reporting out, usually we're referred to a more than 10% threshold within one classroom. Please be sure to call us here at Pima County Health Department. When should you be making this report? That key in the it has small letters on that slide, but it's also within the link. It depends on what you're reporting, and it could be between 24 hours to 5 working days, depending on the report itself. As well as some reporting forms. We have CDRs and outbreak report forms that are within that same link. Next slide, please. Should your school see an increase in respiratory illness, suspected outbreaks? I know they're not in the previous slides, but coming off of COVID-19, there was some time in which this was mandatory reporting, and so we have continued to have an optional portal for schools to report either individual cases of COVID-19 or suspected outbreaks, and we can follow up. Our team checks this daily within Monday to Friday, and we will follow up with schools. And we do have some resources available. Our link has changed. The platform we used to use prior to this new school year was a different system, but the link is here. Like I said, please reach out if you have any questions. Most of our school partners have already received the infection prevention education, and the guidelines have changed. So if you have any questions, please reach out. We also had a very nice session in partnership with our school partners that was recorded about a month ago on the new guidelines, the new respiratory guidelines, and the new guidelines to prevent infectious disease in K through 12 schools. So if that's needed, Chris or somebody from the school team can share out the link. Next slide, please. This slide also has some additional resources should we require them. Next slide, please. For a quick heat and youth update from our epidemiology team, we have a few informational slides. Why is heat and youth important aspects to look at in our school communities? Because kids or children's bodies cannot regulate temperature as well as adults, or also because kids may not have the knowledge to protect themselves during extreme heat. We're in the middle of the summer, in the middle of our heat season, but the following slides do have some very nice tips on what to do that could be shared with parents or with your school communities, including appropriate clothing for kiddos and children, as well as making sure that water and fluids are available, making sure that they stay in the shade as much as possible, especially in peak heat hours of the day, making sure that kids are taking breaks when they can. And while outdoor activities during the coolest part of the days are should be encouraged, please make sure that fans are utilized, but only if the indoor temperatures are less than 90 degrees Fahrenheit. there's that caveat there, and also a very nice link from heat.gov for children specifically, for you to share out with your school communities. Next slide, please. Our team, our epidemiology team, has put a very nice data site. It's beattheheat.gov. I might be butchering the link, and I can put it in our slides or in our chat box here, but it's also in the very last slide. That covers data reporting for our heat season for this current year. From these figures, we know that school-age children, so that's if you look at the bars on the top left, where it says 1 through 14 and 15 through 19, both of those boxes add up to around 10% of the heat-related Pima County Hospital visits for the current season. We also know that there may be more cases, but they just don't end up in hospital. So it is a significant group that we're seeing that are affected by a heat-related illness. So far this summer, there has only been one certified heat-related death of a minor, and that's represented on the figure in the bottom of the left side of the corner of the slide. Sorry. Next slide, please. A few additional subgroups within our schools that require a little bit extra attention is heat and athletes, because athletes are regularly exerting themselves by doing additional physical activity, and they tend to push themselves. Once again, what to do? Try to limit that outdoor activity, especially during the middle of the day. Make sure that sunscreen is utilized and applied as indicated on the sunscreen packaging. Making sure that some of those workouts and practices, as I mentioned previously, are scheduled for later in the day, as well as recommending pacing their activity, making sure that they have water available and that they're drinking it at a good pace, as well as utilizing the buddy system and making sure that teammates are checking on each other. Next slide, please. Another subgroup that we tend to see a little bit more morbidity when it comes to heat-related illness is those who suffer from chronic health conditions. Heat can cause extra stress on the body, exacerbating some underlying health conditions, such as obesity, heart disease, diabetes. They can all increase the risk of heat-related illness. Additionally, there are certain medications that children can be utilizing that can increase one's risk for heat-related illness. I have linked, or we've linked here, which medications we're talking about, but just something to keep in mind. Next slide, please. This are pamphlets from the CDC with recommendations on creating a plan and caring for children with asthma on hot days. They cover most of the same information and would be nice for your health school staff to have handy. The main difference between both pamphlets is one is geared towards children and the other one more towards teens, but a very nice resource for schools to have nonetheless. Next slide, please. Heat-related illness signs and symptoms. Once again, another pamphlet from the CDC. If you would like to have this available, you can check the link on the slide, but it covers the signs and symptoms of heat-related illness, as well as what to do if those display. So just something that could be a very nice visual aid for your school communities. Next slide, please. And getting towards the end of the resources that we have available for you today, we have this daily heat risk tool, which is a relatively new tool from the CDC that we think is very helpful, where you can look for the heat risk based on your school zip code. So if you look on the top left of the screen, you can enter there, put in the zip code from your school, and it'll recognize the county and the state, and it will give you that day's heat risk and suggested actions to protect your health for that day. The link on where to access this daily heat risk tool is at the bottom right of this slide. Next slide, please. Additional resources, as well as what we have already quoted throughout this presentation, can also be found in this slide. And now I can take a few questions if there's any. Okay, seeing none. I was gonna put the Beat the Heat website on the chat, but that's linked within the slides, and Chris will be sending those out later today. If you need to contact Pima County Health Department Epidemiology, please email us at epi@pima.gov. There's our phone number and our fax number, as well as what is mandatory reporting according to Arizona Administrative Code, and our outbreak reporting portal should it be needed. With that, I think I'll pass it on. Let's see. I do see a question. If we want some of these as posters, are they available to us that way? I don't think we have any posters, so we are linking the CDC materials, and I think it would be onto you to print some of them as available from the links that are within the slides. Chris, does your team have any ability to support printing?
I'm not sure. I can get back to you on that. Um, but
Okay.
yeah, I don't believe we do, but I will
Okay.
get back.
Well, thank you so much for the question, and thank you for sending information out, Chris. With that, I'll pass it on to the next person on the agenda.
Thank you so much, Eliana. So next we have Kayla Allender. She is our health navigator who is going to be presenting on the health navigation referral form process. So Kayla, you want to take it away?
Yes, thank you, Chris. Hi, everyone. My name is Kayla Allender. I'm the health navigator on the youth and schools team, and I will be presenting the referral form and how to submit that. Next slide, please. So the purpose of the referral form is to help connect youth and their families to services they may need and help eliminate barriers to those resources. We're helped to eliminate the stress involved in finding the resources. We know how complicated it is to navigate services and resources within the community, and the health navigators are here to help have it be a one-stop shop to finding resources that can help. Next slide, please. So this is what the referral form looks like. It's a document that connects tailored services to those in need, regardless of age, gender, immigration status. The form is available in English and Spanish, and there is translation available as well. Next slide, please. The referral form can be filled out online by utilizing the QR code, or it can be physically filled out and emailed to myhealth@pima.gov. The referral form is only to be completed by parents and caregivers, or by a school staff member that has capacity and permission from the parent and caregiver to fill out the document. It's important to note that we cannot accept submissions by students under the age of 18. Within 7 days of the referral form being submitted to us, a health navigator will contact the person requesting services to gather more information, or based off the form, provide the resource information that they have requested. Next slide, please. The information that we ask for is contact information as well as some demographic information. We want to make sure that we're being respectful and mindful of their identities and how they would like to be addressed and contacted. We have options for email, phone call, text, best time of day to be contacted, and if the interaction has to be confidential or not. Okay. Next slide. Thank you. These are some of the resources that are most popular that we see. So there's access insurance help, birth control, breast and cervical cancer screenings, COVID testing, vaccination, diaper distribution, food resources, housing, just lots of great stuff here. Um, and there's also a little section for notes. So if there's anything specific that is not listed here, it can be documented right there. So a health navigator could help find those resources. Next slide, please. And on the back of the document is a description of all the resources that are listed on the sheet. This is not exclusive to what Pima County offers. The health department has many services available in-house, but health navigators connect families and individual to outside organizations that can help with a wide range of other services that also may not be listed here. And here is just more of those resource descriptions that are on the document. And those are also available in Spanish as well. Next
Thank
slide.
you. Thank you so much, Kayla, for that. And we also want to also offer these resources are something that we are willing to send out like physical copies to school staff because as you know, families, parents have a huge task of dealing with a lot of things, and we're just trying to help eliminate some of those barriers. And this is something that we really want to ensure that they have access to, or even with the school staff for them to send out to the community as well. Um, with that being said, if there's any questions, please put them in the chat. Um, but if not, we can move on to the next presenter, which is Ann Hoffman. Ann, are you on the call?
Hi, good afternoon. Thank you for having me. My name is Ann Hoffman. I am the Assistant Director of Clinical Services for the Pima County Health Department. So I oversee not only our brick and mortar, which is our 3 clinics, but also our mobile units. And we have many mobile units that I'd like to kind of share with you about some of the services we can provide. Next slide. So these are just a couple pictures. We actually have been graciously granted a new mobile unit that is a little bit larger and offers more services, but the goal is for the mobile units to come to where you are at so we can provide these services. Next slide. So what do we do when we're out in the mobile unit? Well, we do a lot of things. Our goal is, again, we take what we do in a brick and mortar and we take it to the mobile unit. So when we are out in our school systems, one of the things that we definitely do talk about is reproductive health and information about what that means. So one of those things is talking about STIs, including HIV, chlamydia, and believe it or not, I know this is hard to believe, but syphilis in our county is on the rise. And so we really want to talk with our youngsters about what this is and what the impact is. So in the county of Pima County, we are 5th in the nation for syphilis, and we are 3rd in the nation for congenital syphilis. So that is when a mom passes it on to a child. So we really want to have these hard conversations. But what we want to do is have the conversations about what we can offer, but we also encourage abstinence. That is a big part of what we do. So we provide pregnancy testing and counseling as well as referrals. We do those screenings on those teens, both male and female. And we encourage those students to open up to us about having those conversations and then being able to allow them to, in a comfortable space and giving them the resources that they need. So we are a recipient of a Title X grant, which allows us to provide those services to students without parental involvement, although we highly encourage that, right? We want our students to have an open dialogue with their patient or with their parents, but we also want them to know that they are in a very safe environment with us. Next slide. So how does this look when we're in a school system or in a school? So normally we do it by chunks. So we are at the school in about 4-hour blocks. We work with the school nurse as the point of contact. So she is our main referral, or he is our main referral to us. They become aware about our services and what we do. We post flyers, we give the nurses flyers. So we kind of spread that word out amongst the campus so that students know when and where we will be. We know that consistency is hugely important. So if we say we're going to be at a school on the third Wednesday of every month, we will be there regardless of the number of students that are going to come to us. So the point of contact is your school nurses, but of course we work with your principal and other people on those services because again, we want to make sure that you know we are a safe place that your students can come to, but also know that the parents are allowed to contact us at any point. So the time of those visits really do range, but approximately it's about 30 minutes, sometimes 15 minutes, depending on what the student needs and wants. We really want to make sure that we meet their needs and are giving them the resources that they need. Next slide. So what do? Well, we talk about reproductive health, and part of reproductive health is talking about what a student can be exposed to. So we do a plethora of STI testing. So we do chlamydia, gonorrhea, and we do that in a variety of different ways. We can get a urine sample, we can get a throat sample. We know that the best sample that we can get is via a blood draw. Now, if you're squeamish like most people are, we know that blood draws are not always the most convenient. So we do have a mechanism to do a rapid test, which is really just a finger stick. And we can then kind of narrow it down to figure out if they are having any of these issues, then we can project what kind of treatment we need to provide for them. We do offer contraceptive devices, so that's condoms, birth control, Depo-Provera, Nexplanon, which is a LARC, IUDs, emergency contraceptives. But I really want to emphasize too, the county really does talk about abstinences, and that's very important. So while it's not listed on this, I want all of our school systems to know that that is something that we do talk about each and every time with our students. Next slide. So where are we? Wow, we are in a really great arena. So we are in the Sunnyside Unified School Districts. We have 3 high schools that we focus on right now. Of course, we want to do more. The TUSD, we're in 10 high schools, and then we're in 7 charter schools in Pima County. But again, our goal is to be able to touch all of these schools holistically and allow them to understand what we're bringing to the table and how we can help this population and how we can help them grow and prosper and be the best person that they can be. And we know that there are challenges in this population and with our youngsters, but we want you to know that the health department is there to assist and to help. So we want to continue to grow our mobile services within our teen population. Next slide. So what have we done in the last year or from 2022 to 2023? So we have seen approximately 700 students, so male and female, primarily female. That seems to be the number that comes mostly to our mobile van. We have seen, or we've been to almost 1,200 schools in the last year. We've seen 695 students have received services from us, and that's a variety of services. So I want to emphasize that while our mobile does come out and talk about sexual reproduction and the health of the student, we also offer other services. So if a student has concerns about housing or food insecurities, the mobile unit is able to elaborate and talk about other services that we can provide for those students, excuse me, and their families. So we also have a vaccine equity team. So that team goes out and talks about the importance of vaccines. We know this is a hot topic and has been for many years. But we also know that vaccines eradicate diseases that we shouldn't really have to face anymore, some of those being polio. So we do have discussions with students about that. We don't vaccinate students without a parental a parental approval. So I do want to emphasize that. We do work with the University of Arizona and kind of provide services that go laterally between the two of us. And then we've offered a lot of lunch and learns. And that really is a time for us to talk about the student and what we can offer, not only to them, but their parents and their siblings. Next slide. We have a library program. So what that looks like is that we go to libraries within our county and we kind of, if you will, park our van and we see anybody that comes into the library. So I always kind of like to share the story of the librarian has a completely straight face when that person comes up to them and says, I want to know about what aliens are invading my zip code. And librarians are so good about that, right? They have a straight face, they look it up, but then they also are able to say, hey, the mobile unit's out here. I see that you've got an injury on your arm. Why don't you go out and see them? So that is an arm of what the Pima County Health Department does, and we provide services for those people at any time, no questions asked. Next slide. This is just a letter that we kind of share with our school systems about what we do, how we do it, how we want to engage in anybody. I would encourage anybody on the phone right now or on the online to put your email address in the chat box and we will reach out to you. We want to provide these services for our youth and our upcoming people who are going to be enjoying this world at any time. Next slide. So why we say it's a teen mobile unit or a teen mobile clinic, I want to emphasize that we are a mobile unit that treats teens. So we really put ourselves out into the community at all times. So for example, we are doing a huge event with the zoo right now to encourage families to get their children vaccinated prior to the school year so that when they go into the school, they're all okay, everything's good, it's all been marked off. So while we do focus on teens, I want to emphasize that we focus on families. That's the most important thing. And we focus on families of all walks of life. Next slide. All right, I'll pass it back to you, Chris.
Thank you so much, Anna. I appreciate that. So with that being said, do we have any questions for our EPI team, our health navigation, or our clinical? And if so, if you can put those in the chat. Seeing none. Of course, if you have any questions, feel free to visit our website. That's our school support line. And of course, you can email us at schoolsupport@pima.gov. Thank you all so much for joining today. I will still be on the call for a few minutes in case anyone does have any questions. But if not, I hope you have a great rest of your Wednesday, and I'm excited for this coming school year. Thank you all so much.